So we shall now go on to our second talk by Dr. NIDHI MITTAL. It is Toxin to Medicine, Botulinum Toxin for Aesthetic Use. And she's a director and oculoplasty and aesthetic surgeon from Rana Eye Center, a super specialty eye center in Rohini, Delhi, a specialist in the field of plastic surgery of the eyelids and the surrounding tissue. On to you.
Thank you, ma'am. Thank you so much for this opportunity. Is my screen visible?
Yeah.
All right. So toxin to medicine. So as we know, so botulinum toxin is a dreaded poison causing a serious illness called botulism, which has been known to mankind since time immemorial. So the most common form being the foodborne botulism. However, it was only in the late 19th century that the toxin was first isolated from the anaerobic bacteria. Clostridium botulinum was first isolated as a source of the toxin. So it was then that it was named after the Latin word botulus, which means sausage. Sausage, because it was very prevalent poisoning due to consumption of sausage in Europe. So in 1944, the toxin was first isolated in the laboratory by a biochemist, Edward Shantz, and this paved way for its therapeutic use, which was first demonstrated in to treat strabismus by Dr. Alan B. Scott in 1980. So it was in 1989 that the botulinum toxin first got approved for therapeutic use in cases of squint, blepharospasm, and hemifacial spasm. However, it was fairly recently, in 2002, that first approval for cosmetic use came around by the FDA to treat the glabellar lines. So the toxin itself, it's a neurotoxin, as we all know, and it blocks the nerve signals to muscles, which causes temporary paralysis of the target muscle. So 7 serotypes are known: A, B, C, D, E, F, and G. Human botulism is caused by types A, B, E, and F. So commercially available types are type A and type B toxin, which is a highly refined purified protein consisting of the neurotoxin structure, the hemagglutinins, and the non-toxin non-hemagglutinin proteins. So the different formulations available to us commercially for type A are Botox, Dysport, Xeomin, type B, Neuroblock or Myoblock. So type A is available as a powder form, ready for reconstitution. However, type B is available in a ready-to-use solution form. Each of these formulations are made with some excipients in the vial. Human serum albumin is present in each of these formulations. Botox is available with sodium chloride. Dysport has lactose, and Xeomin has sucrose as excipients in the vial, which are available commercially. So the mechanism of action, the target tissue being the presynaptic cholinergic nerve terminals. So in the skeletal muscle system and the autonomic nervous system, normally in a healthy neuromuscular junction, the neurotransmitter is released at the synapse and the muscle contracts. However, the toxin, it binds and it is internalized in the presynaptic nerve terminal. It binds and cleaves with the SNAP25 protein, and it inhibits the release of the neurotransmitter containing vesicle in the neuromuscular junction, thus causing the muscle paralysis. So this action is used in its aesthetic indications and applications. So as we all know, wrinkles are the lines on the facial skin, which are caused by the repeated motion of the muscles of facial expression. So this toxin relaxes these selected muscles and allows the skin to recover, thus reducing the wrinkles. So this is the anti-aging effect that we are aiming for when we use this toxin. So around the eyes, botulinum toxin is used to treat the horizontal wrinkles on the forehead, the glabellar lines or the frown lines, the vertical lines between the two eyebrows, crow's feet at the lateral canthus of the eye, under eye crepes in the lower lids, bunny lines by the side of the nose, and non-surgical eyebrow lift by depressing the action of the eyebrow depressors. So, however, it has been proven to be a very safe drug. There are certain conditions that we need to be cautious. So, if there is a history of hypersensitivity to any of the constituents of the injection, sensitivity to human blood products and foods, certain foods like eggs and milk. So, because it's a protein, so any history of hypersensitivity rules out the use of the drug. Very important, neuromuscular disorders of muscle weakness. So like myasthenia gravis, Lambert-Eaton's, and amyotrophic lateral sclerosis. So it's a contraindication for use of this neurotoxin. In conditions of pregnancy and lactation, however, there is no definitive evidence of risk of treatment, but no long-term safety studies are available. So it falls under category C. Local part infection and inflammation rules out the use till that part is taken care of. And flu and cold symptoms, if the patient is generally not well, so we can wait and schedule the treatment at a later date. So the preparation is quite simple. So normal saline is used for reconstituting the injection. And we have to be very cautious that the handling of the solution has to be very gentle. So vigorous shaking can denature the fragile molecule. And a very fine needle and syringe is used to draw out the solution from the vial and ready to be injected to the patient. So how much of solution is to be used for reconstituting? So there is a this easy reference dilution table can be used. So for instance, if we need a strength of 4 units per 0.1 ml of the injection, so in 100 units vial, we will use around 2.5 ml of the normal saline. So depending on the strength and indication, so this dilution table can be used as a reference to decide the amount of the normal saline used to reconstitute the injection. So as mentioned, it's a very fragile molecule and easily denatured. So we have to be very cautious for storage and transport. So the cold chain maintenance is integral to the potency of the drug. No vigorous shaking of vial for mixing the solution, and sterility and disinfection has to be maintained at each step of the process in storage, transport, as well as injection. So an unopened vial should not be used beyond the expiry date as mentioned on the vials by the manufacturers. Usually it is reconstituted just before use. And a very important point, because different formulations are available in the market, each of them are not interchangeable. So 1 unit of Botox is the effect of 1 unit of Botox is not same as the effect of 1 unit of myoblock. So this has to be kept in mind. However, the manufacturer guidelines are that the reconstituted solution of botulinum toxin A has to be used within 24 hours of reconstitution. But with years of use, experience, and many studies to back this claim, if bacteriostatic saline is used for reconstitution and cold chain is well maintained during the storage, the reconstituted solution can be used up to 2 to 4 weeks with comparable potency as of a freshly made vial. So, however, it's a very safe drug with very predictable effects. Some adverse events do occur. So, unintended effects are the effects which occur due to spreading of the effect of toxin to the surrounding areas of the target muscles. But they are temporary and they are relieved with the loss of the action of the injected medicine. So very common being brow ptosis when treating the forehead wrinkles, and abnormal peaking of eyebrows, which we call as pop deformity, if the forehead is not treated in a balanced manner. Eyelid ptosis, while treating the crow feet, sometimes the injection spreads to the levator muscle, so causing eyelid ptosis. Tropion and legophthalmos can occur while treating the lower lid. Diplopia and strabismus if the lateral rectus is affected due to migration of the injection while treating the crow's feet. Dry eye due to migration of the injection to lacrimal gland, thus causing decrease in tear formation. Epiphora due to lacrimal pump failure when we are injecting the lower lid medially or punctal ectropion. And while injecting in the lower lid, if the injection goes too low on the zygoma, it weakens the zygomaticus major muscle, causing lip ptosis. So apart from these specific adverse effects, local part swelling, bruising, and pain can be a part of the process, and they resolve quickly. Some patients can have also reported transient headache or flu-like symptoms, but they resolve. And a potential adverse effect is botulism, but it is very unlikely with the doses which are used for the aesthetic purpose. So thank you everyone for such a patient listening, and thank you for this opportunity.
Thanks a lot, Nidhi. Learned a lot. But the one question I have to the expert panel is, when you have these different brands, I know they are different complex proteins, but how do you decide what is your basis to select which one over the other?
Yes, so ma'am, so convenience, availability, also the effect, and all of them are comparables in safety and effect, but I think the most important being the availability of the drug where you are practicing. That is a very important factor.
Dr. Shubhra, on to you.
Nidhi, congratulations for a lovely talk on the basics of botulinum toxin.
Thank you.
I think coming to different brands, it depends. I think you have to have your own research and a comfort level of using which brand you want to do, right? As she mentioned that each brand has its own pros and cons, its own efficacy, longevity. So I think a good literature search on what works best in your hands is the key forwards. At the end of it, there are people who have tried different brands on the same faces for different indications, and it works fine. But for me, for example, is only one brand which I'm comfortable doing with, and I have got consistently, good results. So also the consistency and the repeatability of the results is very, very important in your hands. So that's what my take home message would be.
Thank you, ma'am. Definitely.
I would like to say something here.
Yes.
I agree with Dr. Shubhra. Definitely that the comfort level is important. The pricing also sometimes make a choice, and there are few brands in the market which are less on price, and sometimes the newcomers or people who want to try with the lesser pricing can go with the other brands. I have tried few other brands, but as Dr. Shubhra says, Botox has a very consistent and very reproducible results and effects. So I am also very comfortable with Botox for the last, I think, more than 15 years now of the practice. And this is without any financial interest. And also about the dilution, which Dr. Mittal said, probably in our practice, we are more comfortable making a dilution of 100 units in 4 ml, which makes it about 2.5 units per 0.1 ml. There was a presentation which suggests that if it is more concentrated, then the dispersion area is lesser. So if you go with something which is about 4 units per 0.1 ml, the dispersion is around 1 centimeter. Whereas if you go with 2.5 units per 0.1 ml, the dispersion is around 1.5 centimeters. So you can have a better effect with a lesser number of units. So you can cover a much more surface area. So as of now, I am very much comfortable making it in 4 millimeter of 100 units. So that makes it 2.5 units per 0.1 ml.
Basically, yeah, I'll just add a point. Basically, if you look to it, am I audible? It is
Yes.
basically we have A, B, C, D, E, F, G, right? Of that, it is only A, B, E which has activity in humans. And all this botulinum toxin, that is the Botox, Dysport, Xeomin, Giva, these are all A. Okay. And now we have the B, that is the myoblock, neuroblock. So basically what we say that sometimes we need to switch over from A to B when we see that some antibody is being produced. But nowadays we also have the biosimilars. I think there are people, I have no experience, but in India, I have seen that in many other WhatsApp groups, there are lots of discussion about the biosimilars, the botulinum, all these are being discussed. So basically, it is all A. Whatever we are talking, whether we are talking of Botox, we are talking of Dysport, we are talking about your Xeomin, these are all A. So switching from one A to the other, it makes no difference. I mean, it doesn't make any sense. But if you switch from A to B, in case there is any antibody production, then only you may have a different effect. In case the A is not working well for when you use it for PG some time, or you can use a biosimilar, which is much less cost. Like every medicine has come with biosimilars, right? So the Biogenin, which is being used by many people in the market, and they are getting very good results. Though I have never used it. Like Shubhra has mentioned, I am also sticking to one product. But in 3 of my patients, after long duration use of A, that is the botulinum toxin type A with the Botox, I had to switch over to one of the Biogenin that is only in one patient. And then again, I switch back to A.
So Botox comes in larger units, then how do you make it efficacious for the patient? Do you pool in patients? How do you do it? How do you store it?
Botox actually initially it came in 100 units, but now it also comes in 50 units. And whenever it is for the functional indications, like we use Botox heavily for the blepharospasm, hemifacial spasm, for the headache. So all functional 25, like 50 units. Okay. So usually one is sufficient. 50 units is sufficient for any of the function. But for headache, we go for 100, 150 units because that is the only FDA recommended treatment for headache. Okay. And for the cosmetic, like sometimes what we do, I usually keep it for at least a week. I have found that the efficacy still remains. And there is a paper, I think, Raman, I think you have mentioned, no? Like even the efficacy has lasted for 6 weeks. I don't exactly remember who has published, but they have shown that efficacy can last as long as 6 weeks. But the company people says that you should use it only one time and you finish it within the time and you need to pull in patients. But I have been using even for a week, like which I have keep it in the fridge, especially on the door. And after 1 week, till 1 week, I'm getting good results.
Yeah, typically 6 weeks is the timeline where you can use it. And if nobody comes, we can use it on ourselves, ma'am. Nothing to worry.
That's a good idea.
Any other question, Dr. Shubhra, before we go on to our next speaker?